Hi friends,
Welcome back to Talent Bow.
we are dedicating this episode to all doctors as today is National Doctors Day.
Now, we are at Sridhar's Diacare, one of the best diabetic care centers in the Malabar region and has been serving people for more than 2 decades.
We are here to meet the Chief Physician and Diabetologist, Dr. Pradeep Sreedhar.
Hi doctor, good morning. Myself
Morning.
Chinju.
And myself Neil.
So we won't take too much of your time, but we want to know more about diabetes in children.
See, first of all, let me appreciate the efforts you've taken, both of you,
Thank you doctor.
Thank you, doctor.
to find out about this. This is something which is getting very common because of various lifestyle issues. I think it's a great effort taken by both of you. So now you can ask me what exactly do you want to know?
We want first of all to know about what are the causes for the diabetes in children.
Causes.
Yeah.
Okay. See, diabetes, usually when you talk about diabetes, you classify it as type 1 and type 2. So type 1 diabetes is what is usually seen in infants, children, and younger adults. Type 2 is usually seen in little more elderly. Earlier, we used to say type 2 is usually seen after 40 years old. But now, because of our lifestyle issues, eating habits, or sedentary lifestyle, we see type 2 also much earlier. Even in younger, very young individuals, we see type. But type 1 is different. Type 1 is actually seen at birth, it's seen at very young age. And the commonest cause of type 1 diabetes is actually an autoimmune destruction of the pancreatic cells. See, this pancreas is the organ in the body which releases insulin. So insulin is the main hormone which controls your blood sugar. So if you don't have insulin in your body, your glucose level will go up. What normally insulin does is it transports this high glucose in the blood into the cells. And that's how we all get energy.
Okay.
So what happens is when insulin level is low, glucose level remains high in the blood. That's how they become diabetic. So in young children with type 1 diabetes, there's an autoimmune destruction. The cause of this is still very, we don't know exactly what causes. Many factors, various factors causes an autoimmune destruction of the pancreatic cells. So thereby, there's no insulin release in the body.
So this cease of pancreatic function, it is genetically or
There are genetic factors.
or
also.
any other reasons.
So the genetic factor is one thing. You can get it by infections, various other factors. So this is kind of a self-destruction within the body. Antibodies, they kind of damage the pancreatic cells. And thereby the islet cells in the pancreas is what releases insulin. And these cells are completely damaged. So there's no insulin release.
Okay.
Whereas in the other case, if you're talking about type 2 diabetes, it's different. There's no destruction of pancreatic cells by autoimmune destruction. But there's various other factors like insulin resistance and etc. Those are things which cause type 2 diabetes. That's why it appears a little later.
So can you tell about the symptoms seen in
Symptoms.
children?
Usually, symptoms are more or less similar in both. In type 1 and type 2 also you find the same symptoms. Most of them. The commonest symptoms that you notice are you feel excess of thirst, there's excess of hunger, loss of weight, there's severe fatigue and weakness. Children become slightly irritable. There is even there's nausea, vomiting, and most of all there's something called in children type 1 diabetes, something called diabetic ketoacidosis, which is a very dangerous complication of diabetes type 1 diabetes. So these are the common symptoms which you notice.
So when we get diabetics, so can a person cure from it when they become type 1 from type 1?
No, type 1 diabetes usually it's a lifelong. So you don't, there's
So
no
they will not
pancreatic cells.
come back to normal life without.
No, there's nothing like not coming
Not
back to
back.
normal life.
Yeah.
You can lead a normal life.
Yes, but
Only thing is you have to bring your sugars under control.
okay.
So the difference is in type 1, most of the time you'll have to live with insulin lifelong because there's no insulin production in your body. So this insulin has to be given from outside.
So you said that type 1 diabetes is seen in children. So is that curable?
No, it's not curable, but you have to keep it under control. Curable is like, suppose you get a chest infection or a fever, you treat and then it goes away. This doesn't go away like that. It will be there. But as long as you take insulin and keep it under control, you can be like any other normal child. You can do all what a normal child does.
Okay.
There's nothing like, there's no
No.
handicap as such. You can be like, only thing is certain things you have to restrict, like high glycemic foods, like candies and sugars and chocolates and ice cream. Those things you have to avoid. And you have to keep a good exercise schedule. You have to be active all of the time. You have to take your medicines, insulin regularly. Those are all. But there's nothing. You just because you are type 1 diabetic, I'm less than a normal child. Nothing like that. You can be as active in every field like any other normal child.
So you just told about the candies and also what about fruits? So fruits, will they affect the diabetes?
No, fruits, actually there are certain fruits which you have to avoid.
Okay.
At the same time there are certain other fruits which you can take also.
Okay.
What we generally say is, if you're taking a fruit, you take it as a whole fruit. Never take it as a juice.
Okay.
Because fruit juice is nothing in it. It's just plain water and some
Sugar.
flavor, sugar. So you want to take it and have a fruit, but you have it as a whole fruit.
Okay.
And certain fruits which are high glycemic fruits. I say high glycemic means the glucose content, the glycemic level is higher in them. Such fruits it's preferable to avoid.
Okay.
And the other fruits you can have. But again, it's all how you balance your calories. You have to have a regular diet schedule where you have total amount of calories fixed for the day. So in whatever you eat should be within that calorie calculation.
So during gestational period, these mothers will have sometimes diabetes. So if it will affect the child also.
Yeah, it does. If mother's diabetes, sugar, glycemic levels are not under control during gestation, it will definitely affect the child. You tend to have a lot of complications at the time of delivery, and even following that, child can have problems. Usually, the children are overweight in the diabetic mother. So even at the time of delivery, mother can have a lot of problems. The child can also have problems. Most of the time, you have to go in for cesarean section, and normal delivery may not be possible.
Okay.
And if the sugars are not controlled during that period, the child can also have a lot of problems. That's one period which you have to be really careful. In gestational diabetes, you have to be really careful for the mother as well as for the baby.
Then this is now we are in COVID-19. So diabetic children should take any precautions in this period.
See, COVID, first of all, it's a new virus.
Yeah.
Yeah.
So, we see the last 6 months it's been there.
Yeah.
And so, actually, we don't know the entire information about that virus till now. Although a lot of studies are happening, there's so many things which are still unknown to any of us. So, what generally it says is when it affects a person, child or an adult or whatever, with any other comorbid issues. When I say comorbid, it's somebody who is suffering from illnesses like diabetes or hypertension or cardiac disease or all those any such illnesses, when they get this infection, they are at more risk of getting into complications. In You asked me whether in the child how it
Yes,
is.
child.
Okay. So in children, usually we see, so far from the recorded cases, we see only less than 2% of the recorded cases COVID positive are children among the recorded. So far what we know, the incidence of COVID in children are significantly less compared to adults. Now, if you're talking about a diabetic child, of course, diabetes is a comorbid situation. You will definitely have a higher risk than a normal child. So, we still don't know why it is COVID is affecting less in children compared to adults. So I think there's one study which says the first point of contact of a COVID, where a COVID attacks is a ACE2 gene expression in the nasal epithelium. That's how it enters the host. So in children, these ACE2 gene expression levels are low. So perhaps that could be one reason why children are not affected as much as adults. But it's again, as I told you, it's just a 6-month-old virus. We're all learning what it is. We don't know exactly. What more do you want?
Okay, in diabetics, you said that there are 1 and 2. So the
Type 1 and type
1 and type 2. The type 2 can be cured slowly.
See, type 2 again, as I said, there's no complete cure for that.
But
Just that
they can recover slowly, right?
Yeah. They can also lead a normal lifestyle, but certain restrictions, as I always tell my patients also, you have to give away certain things, like high glycemic food, and you cannot be sitting idle. You have to exercise and keep yourself fit, maintain your body weight. Those are the things which we recommend every diabetic patient. So that's also, and there's nothing like a complete cure. The only thing is you have to take medication. If you're on insulin, you take insulin regularly. If you're on all hypoglycemic drugs, you take that regularly. Control your sugars properly. Lead a good, healthy eating habit, healthy exercise schedule. That's it.
Okay.
Anyway, I think I'm really impressed with you guys. With you,
Thank you.
Thank you, doctor.
This is something because now the generation is more after all this computer. I mean, watching television, and you took your time for something very informative like this. It's very nice.
Thank you, doctor.
Very nice. What are your plans with this? With this interview? What exactly was in your mind when you did?
So in our mind that we were like Doctor Day was coming, the National Doctor Days were coming.
Oh, okay.
So we thought
So as
we
to
can
spread an awareness amongst children
Excellent.
about diabetes.
Very nice.
because
Especially when it comes from
nowadays
children like you, asking questions on diabetes in children. It's very nice. I haven't, nobody has so far interviewed me on children. I don't know. There are so many other interviews we do regularly. But children like you interviewing is something new.
because nowadays most of the children doesn't know anything, so they just sit at home because of COVID-19. They sit at home. They don't know what's happening. So we thought that with this Doctor's Day, they get something informative.
Very good. Excellent. That's nice. And I also came to know that the entire show is done by both of you. You do the comparing, you do the filming, you do the voice editing, you do the video editing. That's nice. Excellent.
Thank you, Doctor.
Very nice. All the best to you. God bless
Thank you,
you.
Doctor. So at last, what will you say to others, to other children?
About
At this present situation, what do you like to tell
Like a message.
a message?
message. What I would tell them is, look at these children. These are the examples, You should all be like this. Take up things which are very interesting, which are happening now, rather than spending your time more on watching stuff which is not really healthy for you.
Yeah.
Wasting your time sitting and doing nothing. Do something like this, which is creative, which is useful for you, useful for the society. It can help you. It can help a lot of people who are watching this. So I think utilize your time properly. That's all we should be doing this time. We're all indoors now most of the time.
Yes.
So let's not waste it on something which is not useful to you. Take up something which is good, which can be helpful for you and also to the society.
Thank you, Dr. Agarwal, for spending your most
welcome.
valuable time.
Very nice. I thoroughly enjoyed this. Thank you so much.
You're welcome, doctor.
I wish you a happy Doctor's Day also.
Thank you. Thank you.
Thank you.
Please do like, share, comment